Good afternoon, everyone. This is again Ahmed Alsayed. This is Anan Ibrahim. She is a surgeon. Both of us are working for Signature Clinics. Today is the first episode of Signature Stories podcast. Today we are recording in from Pines Hospital. They have a fantastic podcast studio. So, Anan, can you just introduce yourself?
No, what do you mean introduce yourself? I hate it when somebody tells me to introduce myself. I'm just like the girl next door. I'm Anan Ibrahim, plastic surgeon specialist, plastic surgery specialist, not
Yeah.
plastic surgeon specialist.
Yeah.
And I my primary interest was always aesthetics, which is what got me into plastic surgery. But
Right.
I've done my fair share of reconstruction, burns, and hand surgeries, and skin cancers and whatnot.
Where were you born?
Nobody cares about where you're born, Ahmed. People just want to know like where you're originally from, probably.
Yes. So I get that question a lot.
Yeah, so do I.
And
I get
my
it
answer
every 2
is-
seconds.
Can you guess?
Well, you see, I don't want to do that because that's what I do with my patients in clinic. So why should I talk about it now? They all like, I want to save that for,
People like the 70 people that are watching us, they can't wait.
Oh, come on, Ahmed.
Just let them know. That's fine. I was born in Egypt. I know even where I was born. I was born like in an OB/GYN clinic that I know by, like if I go back to my hometown, I know exactly where the clinic was. I know even the OB/GYN doctor that.
Okay, I wasn't born in
Did-
Egypt, so I'm not going to say where I was
Alright.
born.
Guys,
To start with,
DM us if you can guess where Anan was born. Good
why
luck.
does it even matter?
Because that's fun.
It's not supposed to be.
Fun. Okay. What made you a plastic surgeon in the first place? Why did you decide?
Just making differences in people's lives.
Right. But I mean, all doctors, all surgeons, I think in a way or another they can do. So, was there something in your mind that you said, you know what, I want to be a plastic surgeon?
I love how artistic it is,
Right.
and how in a lot of situations it's challenging, and how you can come up with 1,000,001 ways for the same situation or the
Right.
same kind of case.
Right.
There's 1,000,001 solutions to it.
Right.
Everybody sees it differently. And that takes us back to something even deeper, which is perception. This is all about how people perceive things. So there isn't a standard for beauty. It's always just how you perceive it. Just like they say, beauty's in the eye of the beholder. So, but there are things that are written in the book, but sometimes even if you apply these things on everyone, that's not the true definition of beauty. So in a nutshell, what I'm trying to say is that I think that the challenging bit is trying to understand how the patient perceives their beauty and delivering that to them. And there's various ways that you can do it, which is the challenging and artistic bit. So all of these things all together is mainly what moved me to take this direction.
Right. Like when we were 2 days ago together, that course, this course is like a 1-day course that was by the Royal College of Surgeons in Edinburgh, but they did it in London, and it was really nice. It was a good opportunity to see, people who are doing the same thing from other place. And there was a question that was raised at the start: what is the difference between plastic, aesthetic, and cosmetic? And if you can go back to the origins of that. So I'm not saying that I know it all, like, like before that question was asked, I at least knew like a little bit about it. But when I Googled it, I was really surprised. So plastic, from the Greek word plastikos, and it means putting things in molds, like changing the shape of the things. And cosmetic means putting things in order. So, like putting things next to each other, the art of putting things next to each other in a good and a nice and an ordered way. And aesthetic is putting things next to each other in a beautiful way, or reading the beauty of the thing. So there are 3 different things, and they are very intermixed. Like in real life, we say plastic surgery if you are speaking about the whole thing, so the cosmetic or the aesthetic part of it. The hand surgery, the burn surgery, the microsurgery, the reconstructive surgery, the hand surgery, the maxillofacial surgery, and so on, breast surgery. And aesthetic and cosmetic, there's like, a huge gray zone between 2 different things. But I was, a little bit taken by looking for those terms.
I agree because I remember him asking that question, but I think it was more focused on what's the difference between aesthetic and cosmetic.
Yes, I said
And
like,
I was really
let's look.
puzzled, believe it or not.
Yes,
And I was trying to think, but it's really good that you actually told us or Googled it
and
to
that's
let
the
us
difference
to
between us.
enlighten us. I thought it would be the other way around though, because it always sounds like when you
So
go
it's the
makeup shopping, it's
cosmetic from the
cosmetic
cosmos,
cosmetic products.
from the cosmos. So it is the art of feeling things. You can perceive things actually and put them in order.
Yeah, but why is that not to beautify something? Why is it the other way around? I would have thought it was the opposite.
I
Like
think you are.
aesthetic is putting things in order.
I think you are moved by the fact it is used now. It's like tasting a strawberry flavor in a drink, then saying later that this thing tastes like a cough syrup. But because they use that flavor forever in the cough syrup, so that's why mentally is linked in your mind that this is how cough syrup tastes like, but this is a strawberry flavor.
So all these brands that say they're cosmetic brands are actually like they should be calling them aesthetic brands.
Yeah, but I think it's a hard word. It has an A, then an E, then an S, then a T, and an H. Is
Well,
like hard.
in America, it's actually ES straight away. There's no A anymore.
Yeah, but we are not Americans. Right. So people will ask all the time, what does your name mean? Because this is also one very important thing. Like, this is how I think when I find the term or anything, I have to find out what that word means.
Are you asking me what my name means?
Yeah.
Okay.
So
So
first of all, how you spell it, because
yeah,
it's when we are saying in English, people who are English speakers, there are a few letters that they cannot just pronounce, and it's super funny when we are in theaters or anything in a meeting room. I'm trying to teach them how to say few words, few sounds, and they are just
they're not coming out.
they just can't, because you cannot change it just in a day, right?
True.
So the sound they can't.
Yeah. Yeah.
They can't do that, and they
But
keep
I mean,
calling me
in
Ahmed and
Liverpool,
Ahmed and those
yeah, in
things.
Liverpool actually they have sounds like
Yeah. So
Shechen.
so maybe those maybe this part will be able to say that sound, but when you
Yeah.
meet someone from London, Scotland,
Yeah,
maybe
they won't know how to.
yeah, maybe they're not able. So when they say the sound, and I say, imagine if you are a snake that just has spicy food. This is how you sound like.
So my name is actually pronounced as Anan.
Yeah, so this is you can't do that, guys. I'm so sorry. You can try, and you can video yourself and share your experience trying to say that sound, like trying to say Anand's name.
Well, you can say it. So why'd you say it wrong now?
Yeah, because I was born there, right?
Okay, but you said it wrong now.
No,
You
no,
just
I
said
said
Anan.
Anan. No, it is Anan. Anan. Can you do that? I know it's a bit of a challenge, but we would love to see you guys trying to say it.
Anyway, so what it means is the highest point in the sky.
Nice point in the sky. We go in a spaceship and meet the aliens, and they answer the big questions.
Come again? I didn't hear that bit.
That only comes once.
Okay.
Then
And it also means infinity. So like you can like I can't literally translate it because if you translate things literally, they just don't make sense from a language to a language, obviously. But
I know
so
what you're talking about.
just,
So
to when Buzz Lightyear says to infinity and beyond, that's what my name means. I'm the infinity there.
this is also another thing for you guys. Is Ahmed. So I don't know if you can say it, amazing. If you can't, amazing. That's completely fine. We get that. I think it means the person, I mean, who praises God the most, or the person who receives most of the praise. You can do it this way or that way.
Praise or gratitude.
Like this or that, like say, like the person who can say thank you, and I do a lot. So early March 2011, and that was in a military hospital. I started my training in a military hospital, and it was a Monday, and I went for the major round. The worst burn case I've ever seen in those 2 years that I started doing burn. And
So you
recon.
you did
Started
burns
with burn
before
first.
you went to the military hospital.
No.
So that was your first
My
placement.
first encounter.
Yeah.
Yes.
That's like me, by the
And
way.
the like the biggest case, the case with the worst outcome. Unfortunately, even the patient did not
Survive.
make it. He was there, I think, for weeks and weeks before he couldn't make it. Right. But it was one of the worst cases, and that was my first day. My first case And after I saw that poor guy, I said, I think I made another wrong decision here, choosing,
Yeah, I
this.
agree. I was in a very similar position. In fact, I was in the very same hospital, and the very
Wow.
same
See,
thing
so that
happened.
so that so that was a coincidence. Except we weren't together. So when was it? That
It was
was
just a year before
the
your
same year. Ah,
a year before you.
the year
Yeah,
before. Yeah.
2010 I
Yes.
started.
So we actually I think we spoke
I
about
left, you took my
common
place.
people. Yeah, like common people that were in both of
For
our years.
sure.
Yeah.
For sure. Yeah.
Yeah. So it's a military hospital in Egypt, guys.
In
Just
Cairo.
in case
Yeah.
you were wondering. And of course, it built me. It built my personality, my knowledge. Being that young, that unexperienced at all. Um,
It was definitely a very intense introduction to plastic
of
surgery.
course,
We were
an
exposed
intense
to,
environment
because
too.
it was one of the biggest burns units in Cairo at the
Right.
time,
Yes.
and
I think it was the biggest burn unit in the Middle East that time.
no, at that time I think Demirtash was a bit bigger than it
Right.
at that point, but
Right.
it was like the second biggest, which is like
Right.
equivalent to.
Yeah.
And they did get major burns. Most of them were resus burns that were
Yes.
kept in.
Yes.
There was a burns ICU, and it was incredible how when we used to walk around. Do you remember the dressing tubs?
Yes, of course.
Yeah,
So
that was
so it
the first
so
time
it
I
looks
see.
like a bathing tub.
Yeah,
Actually, they put the
exactly.
patient, then they do the dressings for them and everything. Yeah, it changed the way you think even about things. Like I used to eat my food cold. This is how traumatized I was, honestly, for like 2 years till I left. Because all of those burn injuries, you go back to them and you ask how that happened, how this happened. One of them is a
It's from
gas leak. One of
yeah,
them, there's spilled
an
like a whole
explosion.
pot of hot water on them.
Yeah.
One of them is this, one of them is that. Then I got like something like a complex
Mm-hmm.
of heat by any
Yeah.
source or anything that can cause burn.
All right.
And me at this, like I just finished my, high school, just finished my mid school. I didn't see a lot in the mid school, like a lot of burn injuries.
Yeah, we didn't know. No,
Okay,
we
then
didn't.
boom, you're
Yeah, and then you just
surprised.
see the biggest burns probably on the planet.
Yes, because
Uh,
also it's a military hospital, so you see
exactly.
things that they are not like, it's
Yeah,
like a
they're not the
military
common
grade burn
things.
injuries.
True.
And
Even the hand traumas were pretty
exactly, because
intense.
you are dealing with very heavy machinery.
Yeah. And they were all mostly soldiers that had
Yes.
these major traumas.
Yes. Don't get me wrong, it's a dangerous environment, even if you are in the country that yes, it is a very dangerous zone.
True.
And
Yeah, because
you're
accidents
dealing with
happen all
super
around the
heavy
world.
things. Yes.
But the flow, and it also came to my surprise that there was a fair share of skin cancers there as well, which I didn't expect to see in
Right.
Egypt.
They are, of course, less, and you're
They're
not.
a lot less than
Yes.
they are over here.
Yes.
There's no
Yes.
comparison, of
Yes.
course. I
Yes.
mean, over here there's like loads and loads, obviously, because
Very
it
high
depends
rate, of
on
course.
the skin type, essentially.
Yes.
But there's a lot more than I expected to see in Egypt. So I thought that they were almost non-existent in our race, or like in the Egyptian, like in Egypt. But
Yes.
but it came to my surprise that they actually do exist, and we did a lot of them there. They also had laser machines there.
Yes.
So we did a bit of that, and then I think it was twice a year, they'd get somebody, an expert from Germany or from a European country, and I remember that.
I met a few of them.
True.
It was really useful.
Yeah, I also I met
Do
one
you
of them.
do you remember any name?
Yes, Edgar Beamer.
Yes, of course I
This
remember.
guy was the German guy. I think he's based in Munich, and he came. He's got decades of experience.
He was in his early 70s.
I think he
That
was
time.
quite, yeah, that time. That was like
And I
a
think
good 15, 20
he did
years
the
ago.
first bilateral upper limb transplant.
I didn't know that, but I could see it from him.
He is the one. He was the patient was a person on a tractor. That is the way he makes his living. And he had an accident. He lost both of his upper limbs, I think, just below the shoulders, and they got him two upper limbs from a person like a freshly dead person, and they transplanted them to him. And of course, they gave him all the immune modulators after that. And the guy has a video of him operating his tractor again.
That is amazing, because not only that you're restoring the anatomical deficit,
It's
but
really
it's
hard.
also providing function,
It's
and
really hard.
the function in the upper limb
Hmm.
is very
Crucial.
complicated. It's crucial
Crucial.
and
This is
complicated
how
to
you feed
restore.
yourself. This is how you make a living, and he did this surgery way before the bionic arms, the bionic limbs were something, right? So now, of course, they are like, you
I
know,
mean, it's impressive enough that this guy
crazily
actually survived
advanced.
this accident, because
Yes,
like losing
blood
your
loss is crazy. Of course,
upper
yes,
limbs over
blood
there,
loss is
the
crazy.
arteries are huge
But
and you could
yeah,
just die in seconds. So
he was destined to make it.
that's good. So
Um,
yeah, so Edgar Beamer, when
mm,
he came,
mm,
there was also, he did some. He's mainly an expert, I think, in burns or reconstruction in general.
right.
But then I also saw him do breast surgery cases.
Aesthetic, crazy. The first person I've ever seen him doing a blepharoplasty was him. A face and neck lift was him. He's amazing.
Now this guy really touched me because um, I, you know how you said starting in the military hospital was more or less a bit traumatic, and you were kind of scared of hot things for a while, which is a normal reaction. I think most of us who've seen extensive burns like the ones we've seen have been through the same thing. But I remember when I was just about to be like, did I actually make the right decision about plastic surgery? And
Same question I asked myself day one.
when I saw Edgar Beamer, I remember he looked at me and he said, "You're gonna be good." And that, ever since that's what made me just stick to my decision, and yeah, do my best and everything.
Yeah,
So,
the issue is that I met Edgar Bell my second year, so
all right,
yeah,
okay.
so I knew already.
You knew that you were stuck in this.
Yes, that's it. So he didn't
Yeah,
have to say
it
anything.
was too late to
I
change your mind.
I was already presenting something already,
Mm.
like on that scientific day. I still remember that very clearly, and it was like a long day of presentations, right? And you find, all the seniors, all people from like the uni are coming from different unis in Cairo, coming to put their presentations on. And he had even like a presentation about, that surgery, the bilateral upper limb
Transplant.
transplant. And I had my presentation, I think, about something like burn toxemia or something. And I looked at one of the microsurgeons who came from the uni, and he was asleep.
Well, there isn't much for them to say there.
He was asleep, the guy. The poor guy got bored of what I'm saying. He said
Yeah.
like, "Who's this youngster?"
Mhm.
So yeah, but it was golden days. So many friendships.
Yeah, you just brought
We
back
did.
the
I
good
think.
old
I think. I
days.
think also you did like 2 years in there, right?
Sorry?
2 years in there, you did.
No, no. I did 1 year, because
Right.
after that I got a residency placement
Right.
in Dar
Right.
el Fuad. So
Right. Right.
I moved out. I didn't finish the 2 years, but
So it's another private hospital, is it?
it is,
Right.
yeah, that
Yes.
it's a
But it's
private
also a
hospital,
huge,
and that's,
giant hospital in
yeah, and
Cairo.
that's really what got me into aesthetic surgery, because there
Right.
was a lot of aesthetics there.
Right.
I also did general surgery as
Mhm.
part of our training. We have to. So I did almost a year of general surgery there.
Right.
And we did obviously see a lot, because we have to see a lot of general surgery stuff. But then after that, I did the rest of my residency as part of the plastic surgery department, and that's what introduced me to the whole world of proper aesthetics.
Right.
They were top professors in Cairo,
Hmm.
and a lot of them are internationally known. And then one of them used to take me with him outside of this hospital to his other private clinic,
Right.
and work. And
That's always a good
well,
thing to
rest
see
in peace.
things. Yeah.
That
Oh.
yeah, he passed away recently, but he did lay the foundation of almost everything that I follow right now,
Wow.
and yeah, very
You will
thankful.
always have one person.
A mentor,
Yes.
yeah.
So I have one actually. I may like speak about him later. Maybe this episode, maybe like another one.
When I was in Dar el Fuad, the residency program was 3 years long. At that
Right.
point, because I worked,
So it was plastics purely, or did you do
well, it
general at
was a
the
year of
start?
general surgery. It was part of the program. And uh, before I joined it, when I was still in the military hospital, that's when I was actually eligible to apply for the master's degree of surgery. So for us, it was general surgery, and there was obviously part of that master's degree was to have a thesis written down. So, and
What was yours
that
about?
was it was the oncoplastic surgery of the breast.
Right.
So it was mainly it basically was talking about all of breast surgery in terms of plastics, in terms of reconstruction and aesthetic surgery, because it was talking about how to manage breast cancer and how to reconstruct that defect. And along those lines, there was different ways of how to improve the way breasts look like, and how to so the aesthetic part was also part of my thesis, but from a reconstructive aspect, not a purely aesthetic aspect. But conceptually, breast surgery is all, it's overlapping a lot. If you're reconstructing, it's a very, there was a lot of overlap between that and aesthetic surgery as well. Techniques overlap. So that was my primary interest. Well, that was the topic of my thesis at the time. And I was doing the MRCS alongside of
Oh,
my
wow, you
master's
started
degree.
early. Nice.
Yes. So yeah. So I think I
This is,
finished.
guys, the membership for a College of Surgeons, if you
Yes, I
wonder.
did. I did finish that. I became a member in November 2012.
Right.
And I completed my thesis and second part of my master's degree in 2013.
Mhm.
So I was qualified at that point, or specialized, I should say, in plastic surgery at
Right.
that point.
Right. So I had a similar experience. Mine was about advanced burn management. I even published that on Amazon. You can find that on Amazon, guys. If you write down advanced burn management, you'll find the whole book. That is mine, and it's free to download, guys. If someone wants. So, all right. So, what happened after that? Where did you go?
Where did I go? So I came here
Right.
back in 2014.
Right.
Was working in the NHS. I started off in Chester, which interestingly is where I actually left the NHS from.
Yes. How many years did you do there then?
In Chester, I did initially the first year when I came to England, and then I worked in Wythenshawe here in Manchester. And then I stepped up in Pinderfields General Hospital in Wakefield, which is next to Leeds. I did a registrar job there, and the training was really good because it's a busy unit. So we did a lot. But then because of my soft spot for aesthetic surgery, I flew back to Egypt and practiced there. Continued practicing cosmetics. And then I was, like everyone else, seeks a higher degree, and I was very ambitious about getting the FRCS Plus, which is why I came back here about 7 years ago. And since I've been back, I was mainly based in the Northwest, working in Whiston and Preston, and back in Chester. Yes, my soft spot reappeared again, and I was sure that I need to go back to what I love the most.
It's like a bug, right? Once it gets you, it gets you.
It's addictive.
Yes. When you like to do cosmetic or aesthetic, whatever you want to call it, I think it gets you, and you just
What do
go
you
back
call
there.
it personally? Do you call yourself a cosmetic surgeon or an aesthetic
No,
surgeon?
I call myself plastic surgeon because I've trained
Yeah,
for the
no, I'm
different
talking
things.
about like from what we're all plastic surgeons, right? Because we all did the
I'm still proud
reconstruction
to call
stuff.
myself
But
plastic surgeon. If you go to my LinkedIn profile, you find plastic surgeon. If you go to my Instagram page,
no,
you
but
find
like
plastic surgeon.
from the procedures that you do now, here in Signature, what would you call yourself?
I'll say cosmetic surgeon. If you wanna, if you wanna define thing, because it's deeper. So it's the way of perceiving things. It's the art of perceiving things. Like you can feel things. This is way harder than taking measurements and theory, like applying a theory. Yeah, if it measures this and that, you need to do this and that. But you feel it. You look at the patient holistically. You feel that I think you need this and that, or you don't need. You're a good candidate for this and that, or something looks off because there's this and that. And you look at the patient holistically regarding the lifestyle, the jobs, the dominant hand side, the preferences. So it's like putting everything together from the big picture.
It's fitting the very many pieces in plastic surgery, which is like applicable to all the subspecialties in plastic
That's
surgery.
right. If you are doing any job and you're passionate about it, if you are passionate about it, of course, yes, you will be better in your
So
job.
what's the most procedure you enjoy doing?
It will be a challenging one with a very good team.
regardless of the actual procedure.
Yeah, this is what I feel. So a
Well, that's
challenging one is
interesting.
not an easy one. So something that I need to put my mind in, 100%, focus 100% in it, and have a plan beforehand and everything, and keep asking people what should I do, taking opinions and views and things, and having a very good team with me on the day. Because if you're not having a good team, there's gonna be hell,
Everything goes wrong.
even if it's a basic
Everything
surgery,
gets slow and grows
even if
and
it's a
goes
basic
wrong,
surgery.
and that's when you start seeing
Yeah,
complications happening.
please don't say the c word. So, um, uh, yeah. So, uh, let's talk about what we're doing. I think we can wrap up after that because it's gonna get too long. But let's talk about the nature of the surgeries that we do. That they are very elective. No one needs to do them, and at the same time, they are just like any other procedure that may have risks and complications. So, what's your take on that?
I think elective is one thing and need to do them is another thing. I think that some elective procedures need to be done. So they're not always a matter of want, especially in situations where patients are actually, functionally compromised.
That's a very good point.
Despite it being a cosmetic procedure, but it is actually getting in the way of the function of whatever it is they want to improve.
Do you know, like back in the days, I think 2000 and I'd say 16, 17, I thought about writing down like a paper about the physiologic benefits of doing a cosmetic surgery. But I found one in the PRS and it was too good to top.
I think unbeatable.
Yes,
Uh,
it was really nice.
is it actually the physiologic benefits or functional or psychological? Because I
Both of
think
them,
that
because also
all three of them really.
yes, of course.
I think
It's a huge part.
yeah, and I think these things really make a huge difference with patients or people in general, because our patients aren't patients, right? Most of them aren't. They're just they're people seeking for, improvement. Some of them,
They are
of
coming.
course,
Yes, they are not in pain. They are not
yeah,
limping when they are coming to the
and it's
clinic,
not a
right?
life threatening thing
It
either.
is not, and they come. They want a procedure. It improves the quality of their lives in a way or
True.
another. I have read a very interesting segment in one of the books that talk about the psychology of the cosmetic surgery patient.
Hmm.
It was written down by a Greek plastic surgeon. He's nearly our age, and he was talking about that he read a paper, read like a publication about that they asked the lady who did breast augmentation with silicone implants, like through a questionnaire, they found out that after the breast augmentation, the rate of them having sexual orgasms during like intimate intercourse have increased. While there is no physiological connection to that. This is a mind blowing thing.
It's a self image when
It's crazy to hear that.
no, it's true, but it makes sense because it all adds
But I
up.
mean,
If
like,
you're
there is no like nerve connection between this and that.
Oh no,
But
it's not a physical
changes your
connection, but
mind.
it's
This is
definitely
crazy.
exactly a mental connection, and that has an impact on how you perform everything in life, not just intimate relationships in general. It has an impact even on how you would do your job. About if you feel good about yourself, you're gonna be keen on waking up early in the morning. Like instead of waking up at 8, you're gonna be waking up at 6. You're gonna be working at 110%, not just 100%. If you feel good about yourself, it changes a lot in your life. But
Guys, that just not to misunderstand, that doesn't mean if you are struggling to wake up early in the morning, you need a breast augmentation, right?
it doesn't mean go do cosmetic surgery if you can't wake up in the morning. But on the other hand, some people need it, and that's what you were saying. It's an elective procedure, so they don't need it. But
But
actually,
can you define that? Because I keep telling the patients, by the way, you don't need what you're coming for. No one needs anything that we are doing here.
Yeah, but sometimes they do, and I'll give a very good example. A very common procedure that we do is upper blepharoplasty. Now, when the skin overhangs with time in the upper eyelid, that really does obstruct the field of vision, and you can see your eyelids hanging from the corners of your eyes. It's like you really can't see around, beyond a certain field, which is the lateral aspect, especially, because I believe that's where it overhangs the most, and some people can't drive because they can't see because of the overhanging skin. And here in England, the waiting lists for something, obviously this would be covered in the NHS because it's an indication, it's affecting your the function, like I said, your
Yes,
vision.
but the size of the responsibilities of the NHS is too huge. So I think that procedure and other procedures will have a waiting list.
It's a very long one, and they could wait for up to 18 months, 2 years for them to just get a consultation in the NHS, let alone the procedure. Obviously there's a backlog which is majorly increased after the COVID pandemic. But as it stands, even though things are going faster and they're trying to clear up the backlog, it's still a very long wait. And patients, they're like, usually they're a bit on the older side and probably in their 60s, late 50s, early 60s. And these are the patients that they're still working, but they want to drive to go to work and they can't even work properly. So these are the kind of patients that need this sort of elective surgery. This is a need, it's not a want anymore. But it's still an elective surgery. So that's the example that I could come up with right now. But along those lines, there are a lot of other procedures that we might not feel like they're a need, but they actually are a need. And believe it or not, they are cosmetic
I mean,
procedures.
of course, it improves the quality of life. Don't get me wrong. If you hear stuff from people saying, I need to do this gynecomastia surgery because I want to go into the pool with my kids. Or I've met a couple before, super cool couple, right? And they bike, both of them, they are in their 60s.
Hmm.
And both of them came on the same day to do the Capitan release. And they said, now we're enjoying, biking more than any time.
Yeah. Yeah.
Um, I've heard from patients doing like from a certain patient saying after the upper blepharoplasty saying it is as if someone clicked full screen. My visual field is amazing. I can see things that I have never seen before.
Yeah.
In a way, it's a life-changing surgery, increase the quality of life and everything. Of course, I get that, but also like if a patient, for example, like we need to reschedule or cancel the surgery, I have a certain line that I say all the time so the patient doesn't feel cornered about the procedure. Like they still have time to think about it. I say it's an elective surgery.
Yeah.
Okay.
Yeah.
And no one needs anything that we do here. I can tell you if you are a good candidate or you are not a good candidate. So they don't feel any kind of pressure.
Hmm.
Because at the end of the day, I think one of the specialities that you will have to stick your ethics a lot more than anything is this,
True.
because it's mostly a private practice, and patients, if you want to call them patients, they pay. And at the same time, you will need to make sure all the time that you're not pushing anything on them, you're not cornering them into doing more surgeries just to make more money out of them, right?
And at the same time, I think it's also very important to have a close doctor patient relationship in our field, especially in cosmetic surgery. Patients want to feel like you're always there. Regardless of what happens or how trivial you see it as a doctor, because it could be something small, but to them it's huge, and
It
it's the
is,
first
it
time
is,
they
it is the
encounter
first
these
and the
things.
only time, maybe. For them.
Exactly, exactly. So having that rapport with the patients, I think, is essential beyond anything. So it's not just about, okay, this is I think you're a good candidate for this procedure, so go home, think about the options, think about if you really want to go ahead. But it's also the aftermath, about being there in the aftermath, having a close relationship with the patient even after the procedure. It's like, is everything okay? Are you okay? Do you have any concerns? And the majority of our patients just want to hear that reassurance bit, like, yeah, okay, this is going as it should and there's nothing to worry about. So I think this whole closeness is very important.
I think that also adds to the scope of the podcast, because if we are targeting someone doing those episodes, of course we are targeting colleagues, surgeons, and everything. I get that, and people who work like in the healthcare field. And at the same time, this will be a very good chance, good opportunity to add knowledge to any possible patient or any possible a person who wants to do a surgery to know the rights during the process of seeking healthcare.
Absolutely.
So I think in the next episode we should talk about consultations, consent. I think if we add that to the scope of the podcast, then
Definitely.
that will add another dimension, because this podcast is not about publicizing for the clinic or for our practice. This is the things that we wish to tell each and every person, even if they will not be one of our patients, but we don't have the time or the chance to let them know.
Yeah.
So, yeah, duty of candor, like those things, those terms that patients need to be aware of, because there's no guide to study that from for the patients. We
Yeah.
have a GMC best practice, but there is no like a
Reference.
guideline or reference that is made in the later. Maybe the NHS, they have one on their website, but I mean, maybe patients, they will not look for that. They will look for the surgery itself and what it entails and things, but they will not look at what are my rights,
Mhm.
or what should I expect, or what should I look for if I'm seeking any surgery, not even a plastic or a cosmetic surgery, any other like
In
service,
general.
yeah, in the healthcare. So I think we should wrap it up before we lose more followers, and and that was really nice. The way we do it, because in Signature now currently we have 6 surgeons, 5 of them are in the UK and one of them is in Ireland. And the way we do it, that there is no fixed host for the podcast. So today, if I can call myself a host and Anan is a guest, so Anan is gonna host the next episode with another guest.
You're wrapping up, so say my name
If
properly.
you have time, Anan.
That's better.
And we keep doing that all the time, so you didn't get bored of my face or anything. So I may show again maybe within 5-6 episodes. We appreciate you watching. Just leave us messages and comments. What do you want us to talk the next time about? And we love you so much.
Thanks, everyone.